in Geneva, in a very busy Geneva, where we have the World Health Assembly and the World Meteorological Organization Congress. I know all of you are very busy, and welcome to our colleagues who are following online. And of course, this event is recorded, and for those who cannot follow today, there will be a second chance. My name is Pascal Delisle from the EU delegation here in Geneva, and we're here together to speak about the impact of chemical waste and pollution on human health. So a few words of context very quickly because time is short. Last Sunday started the World Health Assembly, and at this World Health Assembly, a draft resolution on the impact of chemicals, waste, and pollution on human health has been tabled by Peru, Canada, Colombia, Ecuador, El Salvador, Mexico, Monaco, Switzerland, Uruguay, and the EU and all its member states. It includes a lot of references to ongoing processes and negotiations, such as the UN Environmental Assembly and the Human Rights Council, and it's important that we do it here in Geneva, which is a UN hub for chemical and also the basis of Basel, Rotterdam, and Stockholm, as you all know. This event is organized by all the members, co-sponsoring the resolution and with the support of the Geneva Environmental Network. It will be taking place in 5 short steps. First, opening remarks by ambassadors from Mexico and Monaco. Second, more in-depth discussion on the resolution itself by the ambassador of Peru. We will have perspectives from UNEP and from IPEN, so from both the UN and civil society on this resolution and this discussion. We hope to have a few minutes for Q&A, and we'll have a conclusion by Maria Neira, whom everybody knows here from the World Health Organization. So without further ado, I will give the floor to Ambassador Mendes Escobar on my left for her introductory remarks. Ambassador.
Thank you very much, Pascal. Good morning, everybody. Thank you, my dear Carol and my dear Romy, Jacqueline Alvarez. Thank you for your presence. Very important that minute is here in this emblematic event. And thank you very much to Canada, Colombia, Ecuador, El Salvador, Monaco, Uruguay, and the European Union. And I know that this event was organized in a very short period of time, but let me tell you that in my opinion, and seeing in the whole context the assembly of the WHO, this is one of the most important side events because we as Mexico promote the approach of One Health. And One Health has to do with everything, with the environmental, with the sustainable pattern of production and consumption, has to do with the way that we use the agricultural products. I mean, it's part of the One Health. And the chemical waste and pollution in human health is not an idea, it's a scientific evidence. So this side event, in my opinion, is super relevant. So thank you very much for organizing and to raise the attention of this link between the chemical waste and the human health. Mexico, as a part of the core group, consider it's increasingly relevant to address one of the world's most urgent problems, which is pollution and harm to human health and environment, from continued exposure to hazardous chemicals and wastes, which are yet contributing to the major planetary crisis: climate change, loss of biodiversity, pollution, land degradation, water, and food security. Science has demonstrated that persistent organic pollutants have been detected in humans globally, in their food, in aquatic biota, high mountain lakes, offshore waters, and deep ocean trenches. Chemicals have even been detected in breast milk at alarming levels. These reasons compel us to urge the key role of the WHO in the discussion related to the sound management of chemical and waste. Its critical role and unique expertise will contribute to protecting from the harmful impacts on health and well-being and to address different challenges. This resolution is also the ideal framework to enhance WHO and health sector engagement in current negotiations related to the INC, SPP, SICM, and its IP4, ICCM 5, and to continue the work with the framework of the IOMS to encourage science-based review, research, regulation, and contribution that will lead the positive health and environmental impacts and to the achievement of many of the goals and targets of the Agenda 2030. I thank again all the proponents of the resolution and express our commitment with the work of the WHO in its implementation. Finally, I want to thank Diana and Geneva Environment Network for always having the support to bring our voices together and to disseminate this relevant information. Thank you very much.
Thank you so much, Ambassador, and also for recalling the importance of this facet of the triple planetary crisis, the concept of One Health and the interlinked with all the processes ongoing. Without further ado, I'll pass the floor to Ambassador Lanteri from Monaco.
Thanks a lot, and thanks for organizing this early but very timely side event. Thanks, Pascal. Thanks, Sister, for the word. Monaco is very much engaged, and maybe you know that we are very much engaged in all environmental issues, climate change, but also what is related to pollution, including plastic pollution. So we engage a lot in the ongoing negotiations on the plastic treaty. But also we are working, and it's good that Maria is here, that we are working for years with WHO and supporting WHO for years on its work on pollution and health, climate change and health. And I will come to that again a bit later. We are very happy to sponsor this draft resolution. It's after different resolutions that were adopted at WHO on pollution and health, climate change and health, but also all the ones related to chemicals in the past years and decades. We do think that it's a kind of connecting all dots resolutions, because we have a great view on what should be done. And this resolution asks member states to support WHO in scaling up work on plastics and health, and requesting also some reports, and to have WHO engaging in all processes, as you were saying. When we adopted the SDGs, we promoted and we asked for more horizontal management of issues, and the chemical waste is really the good example of why we need this cooperation, this transversal approach in between different fields, starting from UNEP, but also WHO, or when it comes to human rights, to have also this dimension taking into account. I would like also very briefly to touch on the report. that was published in March. And it's the Monaco Commissions on Plastic and Human Health report. This work is an interdisciplinary work. It started in 2022 with 1,500 scientists working on that, and the report focused on the effect of plastic materials and on human health throughout their life cycle. So from their production to their end of life, including, of course, their uses. The conclusions are quite dramatic, and we do see that plastics that are so helpful for our daily life are also a big threat because, of course, of disease, disability, premature mortality at every stage of life, and also of their own life cycle. Once again, those effects affect disproportionately vulnerable, low-income, and minority communities, and the children are highly impacted. We do detect or the plastics or their substances everywhere, including animals, and we do hear about that every day. As we were saying, the 1F approach is really crucial in our discussions in all fora, and the conclusions of this report is that we shall change totally the way we are not only producing plastics but also using them, and of course recycling them or collecting them for avoiding big drama, not only on systems but also on our own life. The report is publicly available, and we do hope with this report made by and coordinated with the Centre Scientifique de Monaco, the Fondation Prince Albert II, but also the Mindero Foundation and coordinated by the Boston College, that it will be something used for the negotiations of the plastic treaty, but which can be used also by WHO in its work. Once again, thanks a lot for organizing this event, and sorry, I guess I have been too long. Thanks.
Thank you so much, Carol, and thank you for recalling Monaco's long-standing support. As you said, this the resolution connects the different dots. That's a very important element for this resolution. And thank you for recalling the Mindero report, as in June we will be going to the important plastic negotiations, very important timing. Going back to the resolution, we're lucky to have with us Ambassador Ticopa from Peru. Peru has been leading on this resolution, has been tabling it, and thanks to you, we can get maybe more in depth on the resolution. The floor is yours.
Thank you. Good morning to everyone. Maria and everyone here. I would like first of all to thanks for organizing this important meeting. For Peru, this I think is very important. We were leading a consultation on this resolution, the impact of chemical waste and pollution on human health. And we have a numbers of countries that is supporting this resolution. As already said, is Canada, Colombia, Ecuador, El Salvador, Mexico, Monaco, Switzerland, Uruguay, and the European Union is member states. I would like to underline that the objective of the resolution is to increase the science knowledge on the human health impact of the chemical waste and pollution, including microplastics, as well as to strengthen the linkage between the World Health Organization and the diverse platform to address the chemical and the waste pollution, such as we know UNEP Science Policy Panel, the strategic approach to international chemical management, the negotiation of the instrument to end plastic pollution, among others. Also, I would like to underline that this resolution was based on that we already knew that new chemicals continue to be developed. The demand on production of the chemical continues to grow, pollution continues to increase, and the new pollutant continue to be undercover, while pollution pathways become increasingly complex. By research, we are also is demonstrated that chemical waste and pollution impact the health of the human and the environment, and that the majority of the world is affected for that. A growing body of evidence shows that transporting pollutants can travel long distance via wind, water, the food chain, and consumer products, with pollutant being found at the highest mountain peaks and in the lowest depths of the ocean. Also, recent studies show the presence of the microplastic not only in our food, but also in our bloodstream, which represent a human health concern. Indeed, the international community is taking action in this issue. As you know, last year, the UNEA adopted a resolution that launched a negotiation process to achieve an international legal binding instrument. Next week in Paris, there's going to be the second round of negotiation on plastic treaty that several delegations have already highlighted that the future instrument is not only an environment issue, but that also firmly rooted in the human health approach. We also wanted to say that the resolution is asking the WHO to publish a report on the impact of chemical waste and pollution on human health from One Health approach. And also the resolution urges the WHO to provide technical support to member states, in particular developing countries. I would like also end this presentation thanking the WS Secretariat, especially to Maria Neiva and her staff for all their guidance and in supporting through this process. Thank you.
Thank you very much, Romy, and thank you also for recognizing the urgency of this resolution with the cumulative effects of waste and pollutants on human health. You also highlighted that this resolution is very multifaceted, tasking different bodies, member states, WHO, and others to do things, and the links, of course, with ongoing plastic negotiations. So thank you very much for this in-depth presentation of the resolution. Now we'll move to the second step of our event with some perspectives on the WHO resolution, both from UNEP and from civil society event. But on my right, I've got the chance to have Jacqueline Alvarez, head of chemical and health branch at UNEP. Jacqueline, the floor is yours.
Thank you very much. It's with great pleasure that I am here with you today. looking not only at the resolution, but also the commitment of the countries that are putting this forward. And I would like to start maybe with an analogy. And you have been talking about connecting the dots and One Health approach. So I'd like you to picture in your mind a golden thread. This line that can connect us all, but it really needs to be a golden one, because this is what we are dealing at this moment. And I would also like you to picture that golden thread in a spiral manner, but not going into the little side of the spiral, going into the big side of the spiral. So you have in front of you a resolution that it's in reality bringing us to this golden thread, connecting things, but also bringing us to the level of ambition that it is needed at this moment because of the different things in the agenda. You know the science, the facts. We know the number of deaths that, for example, the lead contamination is causing. And when I look at the numbers, I always feel very scared. I come from a very small country, from Uruguay. We have 3 million people living in the country for the last 3-4 decades. And when I see numbers, for example, on antimicrobial resistance, pharmaceuticals, pesticides related things, the forecast is that by 2050, 10 million deaths per year will be attributable to antimicrobial resistance. So for me, it means that my country will disappear 3 times a year. You know, trying to picture those things in our minds. Then you look at air pollution and you say today 7 million deaths directly or indirectly because of air pollution. And then we say, okay, what can we do? What are the things that for us are in a way the elements that we can contribute from the places that we are? And we have opportunities like multilateralism. What is happening this week, next week, what is happening this year in general in the chemicals agenda and the chemicals and waste agenda. We must have factual, scientific, robust information. But the big question always, is that enough? And this is where science policy and interfaces start to come into place. We know data from very, very, very long time, but at the end, we have been not maybe moving the agenda in fast track manners to change the forecasts. You have heard also the Beyond 2020 for chemicals and waste. It's going to be adopted this year in September with strong need and commitment to bring health, labor, development, and other areas. Talking about food security, as it was mentioned today, talking about innovation, what can we do to really change these patterns? I would like maybe to finish this with congratulating all of you here, particularly those minds that put the resolution together. Is very timely, it's essential, it can change the patterns, and the golden thread that I was referring at the beginning can really be in a way seen as the line that not only connects us in a linear manner, but also 3-dimensional because of the pattern that it can, the shape that it can take. So thank you very much for the opportunity. From the UNEP side, we are very thrilled to see this resolution moving ahead.
Thank you so much, Jacqueline, for obviously a very interesting perspective and for emphasizing the science policy interface. It's true, we know so much, and we feel powerless very, very often. And it's important also what you said about how multilateralism is still, in spite of the difficult situation of the world, is still one of the best tools we've ever invented to deal with these global issues. So thank you so much, Jacqueline. We have online Griffin Ochieng, and Griffin has been very much involved in all these debates from the civil society perspective. He's a co-chair of the IPEN Toxic Plastic Working Group, and IPEN is a global network of over 600 NGO working on those issues, and he's also executive director of the Center for Environmental Justice and Development. So Griffin, it's a pleasure to have you online. Floor is yours.
Thank you so much, Pascal, and it's a pleasure to be here with you. First, I would want to thank the organizers and the proponents of the resolution, which is coming at a very critical time. And I'm calling from Nairobi. So my perspective, I wanted to focus on the two major chemicals that have also been contributing to the pollution crisis as one of the three planetary crises. And these include the issue of highly hazardous pesticides and plastics. So when you look at the HHPs, the highly hazardous pesticides, these are a global health problem, particularly because they result in deaths, suicides, and many accidental deaths, particularly in children. When we review the global numbers, I just wanted to put into perspective, and particularly because this resolution is tabled at the World Health Assembly. 14 million deaths occur from intentional self-poisoning since the beginning of the Green Revolution in the 1950s. Around 110 to 168,000 fatal pesticide self-poisonings occur every year. 11,000 intentional and unintentional occupational poisonings also occur every year, and uncounted children dying from exposure to pesticides, particularly highly toxic pesticides. We've seen environmental surveys have also been done and identified HHPs as one of the top 6 global contamination issues, a problem that requires immense amount of work. And this is been referenced and focused on in the resolution that I've also been following very closely because of our work in the chemicals and waste sector. With this, bringing the context, particularly from a developing country representative and organization in Africa, majority of these cases that I've just mentioned occur in low and middle income countries, including the Africa region. And if you look at Africa, they're not a major producer of these chemicals, the pesticides, including the toxic substances that are used as additives in plastic. Plastic pollution is a major problem in this part of the world. So, and there's always been argument that 20 to 40% of food would be lost without the use of pesticide, for instance, and food security. When I was just in Geneva 2 weeks ago during the BRS conventions, there's a lot of concerns around the food security, but we ask ourselves, we produce the food, but why produce food which is not healthy? Then we look at the impact on health. Countries have shown, for instance, Sri Lanka, have demonstrated that agriculture can do perfectly well without the most harmful pesticides. Similar experience have been seen in many countries like in Bangladesh, India, among others. So for this argument around food security, it's important, yes, but I think the impact that highly hazardous pesticide causes on human health is one that need to be factored in all these discussions. And glad that the resolution is putting this into perspective in order for WHO to play a very critical role in the same. What is the possible solutions? Is that when we look at the SICAM, which has also been mentioned, particularly the upcoming ICCM 5, Africa region has put a proposal to have a global alliance to phase out highly hazardous pesticides. It's important that this, particularly from the IMC organization, that also WHO play a part, contribute to this alliance, and we hope that this is going to be adopted to catalyze action to address the issue of highly hazardous pesticides. This is similar to other alliances we have seen, particularly the Lead Paint Alliance, which also catalyze a number of action, including the laws that have been established in many developing countries limiting the issue of lead paint. So we hope that this resolution will give impetus even at the ICCM 5 to ensure that this alliance is established. As I almost conclude, I wanted just to also make reference to the issue of plastic pollution, particularly coming at a time when next week we have the INC2. In Kenya, and we actually in the BRS, we presented a report, a finding that we did when we tested a number of products, plastic products in in consumer appliances, children toys, and we found a lot of toxic chemicals in these plastics. These are flame retardants, brominated flame retardants, and others. These are highly hazardous or highly toxic chemicals that are regulated under the Stockholm Convention. And these are made from recycled materials, or so recycled materials that are brought as new products in many developing countries. Yet they are recycled from e-waste, among other, which are containing very highly toxic chemicals, heavy metals, among others. So as we go to negotiate, and this resolution, I hope that will give reality in the negotiation in terms of the need to focus the objective of the treaty to focus on human health as a critical element in addressing plastic pollution. As I conclude, when you look at the issue of the harms caused by plastic pollution, we need to end toxic pollutant production, not just the pollution. Even the production of these products that are toxic need to be ended. Both pesticides and toxic chemicals in plastics. We need a global control on chemicals, on plastics, and a global action to eliminate highly hazardous pesticides, which are killing many African population and farmers across the globe. I thank you very much for your attention.
Thank you so much, Griffiths. And I think the two examples you took on food security and on recycled plastic with some toxic in them are so telling of the real complexity of the issues we are dealing with, and that negotiation ahead need to be extremely precise, because there will be no simple, easy solution, but there are solutions if we put our brains together. So thank you so much. Now I would like to open the floor for Q&As, both here in the room and online. So we have time for a few, because I know Maria will need to leave at 8:55. So please, any question you would have in the room or online.
I have a comment.
Please.
If I may.
Now, I forgot to mention Peru, that they have been working very hard on leading the process. And thank you very much for your vision, because actually it's how I also there was this like a one issue that it could be it linked with One Health. It has to do with the agenda 2030, so we really have the vision to put all together in one resolution. Thank you. Thank you.
Please, yes.
Thank you. My name is Valentina. I'm from the Uruguayan mission, and I would like to thank all of you for this timely event, indeed, and Diana for organizing, and also Peru for being the pen holder of the resolution and to lead this process. You did an excellent job. But I want to mention, that I'm glad that how the health issue evolved on the chemical cluster, because you can imagine the resistance that we found at the beginning. For instance, recently in UNEA 5.2, when we proposed to include language on the impact on human health, we didn't have support at the beginning. So then at the end, we were like explaining to different colleagues, and well, we found this beautiful group of people that could also support the language, and we were able to keep it in the resolution, which was so important. And now we are in the beginning of the INC negotiations, and we found an echo from all over the world on the importance of human health and the relation to plastic. So also, the other challenge that we have ahead, I mean, we are connecting the dots with this resolution, which is very, very important. We are also addressing the gaps in the chemical cluster with the plastic treaty, with the future SPP, the Science Policy Panel, that is so needed to elevate the third pillar of the triple planetary crisis. So climate change, biodiversity loss, and pollution are on the same level. But we still find a lot of resistance. For instance, when we quote diverse reports, we really appreciate the work of Minderu Foundation and Monaco Commission on plastic and the impact on health. Also, we quote many times an IPEN report on EDCs. But many times we still find resistance on the negotiations, and what they say is, but we don't have official reports. We need WHO to say it. And so it's really important to continue connecting the dots, to continue, for instance, I don't know, my actual question is possible in the negotiations that WHO could quote this kind of reports or could validate them, so we can have like a stronger voice from the scientific community with the backup, let's say, of this organization. I think that will be very helpful for us as negotiators to move forward and further. Thank you.
Thank you for your question. Maybe I will bundle it with other questions we received from online, because I think they go well together. It is for the co-sponsors. What first will be the main challenge of this resolution? And second, what will be WHO's role, in line with what you were saying, in the midst of the many processes that already deal with chemicals, waste, and pollution? So maybe to the co-sponsors and to Maria, and then Maria will do the concluding remarks. So co-sponsors, if you want to, with the challenges maybe that you see in front of you, and how you see the role of WHO on the way forward.
You want me to start? Yes, and I follow you.
No, it's I guess that you are very true, and when you say that you are facing some reluctance, if not some opposition, from the environmental people, let's put it like that, we have seen in the past, and still, when we are discussing about those issues within WHO, they are some countries, some representatives still saying, oh, that's not the mandate of WHO. So we have that, and including at national level too, so we are so small. It has been in the past quite difficult to have this kind of communication saying, hey, don't forget health aspects when you are discussing some environmental issues. So I guess this remains most probably the main challenges, and that's why also I was speaking about the need to have an horizontal approach and stop having those kind of vertical approaches. I guess this is the main issue, both at international level, but also within our own countries, and to be able to discuss and to have this kind of cooperative approach.
Thank you. Francisca?
Yes, well, it's almost the same, my dear Carol. Jacqueline mentioned the three dimensions, and this is the perfect example and perfect topic, because we have to create awareness and the right connections and the right institutionalization, not only in WHO, because not only about health, about environment, but we have to create a good interconnection with the UNEP, UNDP, all the agencies at the level of the UN system. And then there is another level at the level of countries. So here again, we have to create in the public institution the right connection, the right commitments at the local, national, regional, and international level. And I think this kind of events are very important, because we really push the agenda in the right direction. And the thing is, we don't have a lot of time. We have to act in a very urgent manner.
Thank you, Francisca. Romy, maybe you want to add on that?
We believe that data is very important. We need data, of course, to deal with this issue and with different ones. But the text of the resolution for that is asking the WHO to publish a report of the impact of chemical waste and pollution on human health. I guess this is going also to help for continuing with this resolution for the coming years. And also for us, it's very important the linkages to work together, not only member states, but also organizations, civil society, and also private sector.
Thank you so much, Romy. I think time is short, and we are lucky to have Maria with us. She had a grueling week, and it's going to continue. So maybe, Maria, you want to both answer some of those questions and maybe do your concluding remarks. I say Maria because I think you need a little introduction here in Geneva, but just to recall to our colleagues online that you are director of the Department of Environment, Climate Change and Health at the WHO, and you've been a pioneer on these issues.
Thank you, Pascal. Thanks for calling me a pioneer. This is a huge responsibility. Bonjour, Madame Ambassadeur. I have the impression that today we could speak Spanish here. Eh? Buenos días a todos. I think we are a majority. How many speak Spanish now here? Wow! Hablamos español entonces. Oh, thank you so much, and pleasure. No, I would like to start thinking really very, very much for the resolution. And I think the role of Peru, I have to look at you as well. And when we started even the discussion around that and the short time in which you have managed to put this resolution on the table, everything was negative. I mean, in terms of nothing was giving us a good options to present a resolution. It was not on the program. And the negotiations, the topic is not exactly a very easy one. So, bravo. I think we will recruit you anytime we will have a difficult resolution. I think we know now whom we need to call and apply your expertise. Please make sure that you do a checklist on what you did to make sure that we have today a resolution on the table. The environment was not easy at all. Just a few reflections. I mean, you know, what we have been saying for many years now about how the environment, Jacqueline, you and I, we have been fighting for this for many years. WHO issued a report many years ago already saying that 25% of the global burden of diseases is linked to exposure to modifiable risk factors, This data, this number has been used by the heads of the UNEP. Remember, Achim Steiner was one of the strongest using that data. Everyone in here is using this number all the time. So all of you have been using this data. I think we need, as you rightly say, Ambassador, we need to have the data, but more importantly, we need to have the means to not only strategically put the data on the table, but the tactics for make sure that this data will be creating the change, that the policy changes that are needed. 7 million premature deaths caused by air pollution. That is another data that WHO has been promoting everywhere. Everybody use, yes, I'm here. I will be very soon. We have been putting those 7 million deaths, even on the negotiations on the Paris Treaty, and some ambassador here will remember very well the difficulties we have on the climate change resolution, mentioning or linking it to the 7 million deaths caused by air pollution, because the causes of air pollution and climate change, they overlap. Yesterday, you saw that we tried to put very central on the agenda of the health ministers, climate change, and we will have an opportunity if we really put together this health argument. I think we can use it to unblock all of those processes. I think the health argument is the one that might help us to advance on action against the causes of climate change. The health argument will be the one helping us to advance on unblocking all of those heavy processes on chemicals. And hopefully the health argument will be the one that will help us to change the behavior and our patterns of consumption, non-recycling, and the use of production, and where are we moving. Yesterday was a very eloquent intervention at the climate change roundtable on plastics by the Minister of Health from the Maldives. And as you rightly say, years ago, it was difficult to bring all of these topics to the health ministers. the same countries that they have been very strong on environmental negotiations to call for the health argument, the same countries, but represented by the ministers of health here, they thought, as you rightly say, that, well, maybe this is important, but we have to deal with malaria, we have to tackle tuberculosis, we focus on diseases. And I think now that the opportunity for doing real primary prevention, come on, we are at the health assembly and we forget what primary prevention is about. Everybody uses this mantra of prevention is better than cure, but we just say it, we don't implement it, because if we were serious about that, this is the opportunity, removing all the environmental risk factors, the chemicals that we have now everywhere that are causing major problems for human health. This would be the best, the bigger public health opportunity ever. So I cannot be more happy on using this health argument, documenting, producing data, but making sure that we have as well the next step on the tactics, what to do with that data, and making sure that nobody will be able to say, we didn't know, that for sure, no excuses. We didn't know is not an option. But then we are promoting the no regrets interventions, because after all, what we are promoting here is primary prevention, no regret interventions on removing a lot of risk for our health and promoting something that will reduce the cost as well for the health system. So I think we have a massive plan here for primary prevention. We have very strong supporters of this primary prevention approach. So let's see if we are very good on the tactics now. We need to be a little bit more Machiavellic, maybe. And that Machiavelli was not a nasty one, it was a good one. On now implementing all of that and making sure that we use the very, very limited resources we have on the best possible way. But thank you once again to all of you for your vision, your courage, and arriesgar un poquito también. Fantástico, well done. Y muchísimas gracias por traer también aquí la fuerza de esta parte del mundo también. Muchas gracias. Thank you so much, Pascal.
Thank you, Maria. And I think the conclusion of we need to be Machiavellic and use health as a trigger for whole of government approach at all levels, global, national, and as Francesca said, also at the regional and
what do we do of the resolution? I don't know if one of the co-sponsor or the colleagues here would like to say a few words on that. Difficult question, maybe it's early, but.
I'm Leslie Army, I'm the head of chemical safety and health unit at WHO. So it's great to be here this morning talking about this resolution, and congratulations to all of those member states that really so much energy into developing it. The resolution itself has some inbuilt mechanisms for reporting back to the Health Assembly. So there's a number of opportunities for reporting on different aspects. And I think that the timing of those is quite important. So timing of the reporting back to get some further decisions out of the Health Assembly regarding, for example, WHO's role in the plastics treaty and the science policy panel. There's a part of the resolution which requests the Director General through the Health Assembly to consider that. So that supposes a special report to the Health Assembly to enable member states to make a decision on that role. So that's very important. Enforcement is, it's soft enforcement, but it's very, very important. And as well, in terms of welcoming the new Beyond 2020 chemicals instrument and making any adjustments to the chemicals roadmap, which is the WHO vehicle for health sector engagement inside chemical implementation. So that's also another opportunity which is important. And then there's a series of progress reports as well. So that will run up to 2029. So, but the progress reports are obviously just a reporting out and don't usually involve any decisions, but the particular opportunities that the resolution includes are reporting back to the Health Assembly for new decisions on 2 different occasions, I think, very good. And then I just wanted to flag, obviously, the program budget allocations is also very important. As Maria said, we are a tiny unit in WHO, and whilst there's a lot to do in terms of engaging other parts of the house, like we heard about suicides and mental health and leading to